Hello, everyone. This is Dr. Sonatis with the Nurse Maker, here again with a short review for you all. Today, we're going to be talking about shock. There's many types of shock. And when I think of shock, I like to think of the mnemonic chain. C stands for cardiogenic shock. H stands for hypovolemic shock. A stands for anaphylactic shock. I stands for infectious or also sepsis shock, and N stands for neurogenic shock. Okay, so let's get to it. Shock it to me, baby. So the first shock we're going to talk about is cardiogenic shock. And with cardiogenic shock, basically, you have enough fluid volume in your body, but your heart is not pumping effectively. So if your heart is not pumping effectively, your tissues are not being perfused. And we know we need tissue perfusion to keep our tissues healthy and alive. So when you're not getting oxygen to those tissues will die. Okay? So there's many different causes of cardiogenic shock. It could be systolic dysfunction, and systolic dysfunction is basically when your body is not able to pump enough in or out. Diastolic dysfunction is another one where you're unable to fill, like the valves in your heart are unable to get enough blood. Then we also have arrhythmias and structural problems. So layman terms, we'll go ahead and say you probably had an MI, a heart attack, myocardial infarction, CHF, congestive heart failure, or even a pericardial tamponade. So a lot of the signs and symptoms that we see when our body is going through shock, for the most part, your body jumps into fight or flight mode and your heart rate increases. So we will see tachycardia. We will see anxiety. Sometimes people who are going through shock have a feeling of doom. Also, because the blood that is circulating is going to the most vital organs, the brain and the heart, your kidneys are not getting perfused. And if your kidneys are not being perfused, you will have decreased urinary output. So we will see oliguria. So in this box here, you can see the clinical symptoms there. As a nurse, what we need to do whenever our patients are going through shock is we need to make sure we have a patent IV line. Usually we want 2 IV lines so we can give them fluids, give them oxygen, and also do EKGs, nitroglycerin. If it's a MI, they may need arthroplasty. Morphine, think Mona, morphine, oxygen, nitro, and aspirin. Also, we can give them vasopressors because when they're going through these shock stages, for the most part, you have vasodilation, and that means your vessels may be open and, again, not enough tissue perfusion. Therefore, your blood pressure tends to drop down. So in that essence, we have to use vasopressors to bring your blood pressure back up. So we may use epinephrine, dopamine, dobutamine. Those are some of the vasopressors we may use to bring your pressure back up. The next type of shock that we're going to talk about is hypovolemic shock. And so just like the name says, we know hypo means low. Volemic is volume in the blood, so low blood volume. So hypovolemic shock can occur because we're losing blood, and that's usually from a hemorrhage. Maybe someone got stabbed, gunshot wound, car accident, and they're losing a lot of blood. Also, this could be because GI loss. So you could be losing a lot of fluid, could be losing, diarrhea, a lot of vomiting. So you're losing fluid and electrolytes, and your body goes through shock. Okay, so obviously, if the reason why you're going through shock is because you're losing volume. We need to replace that volume. So the way we can replace that volume is we can give you IV fluids, usually a bolus. Also, we can give you blood if you're losing blood. Okay, so interventions, again, you need to make sure you have 2 large bore IVs so we can give them IV fluids quickly, give them blood products, and monitor their blood pressure. Right here, I have something here that tells you some of the early signs of shock and the late signs of shock. So in the beginning, your blood pressure may be normal, but as time goes on, your blood pressure tends to fall. Okay, our pulse rate tends to increase, so we're going to see tachycardia. And then afterwards, your pulse rate is still quick, but now it's weak. So you have a weak, thready pulse. Color, our skin color may be normal, but afterwards, because we're not getting that tissue perfusion, we turn pale. And also, again, like I said, your skin may be cool and moist, and later on it turns cold because it's not getting perfused. Okay, the next one we're going to talk about is anaphylactic shock. And anaphylactic shock is basically an allergic reaction that is very dangerous. It is life-threatening. Usually the most common culprits of anaphylactic shock is a drug allergy or food allergy. So many people are allergic to shellfish, eggs, nuts, peanut butter, that type of thing. But also it could be from insect venom, like a snake bite. It can also be from a blood transfusion. So what we see is that we'll see wheezing, shortness of breath, change in their voice. Sometimes people will have hives pop up on their body, and they may have swelling and edema at the site. So what we want to do for this person is we want to stop what's going on. So we want to give them an antihistamine or some epinephrine. So we usually tell people if you're allergic, some people are allergic to, like I said, peanut butter. And they may take a bite out of a cookie and it was cooked in peanut oil. So we usually tell people if you have a severe allergy, carry an EpiPen. So EpiPen is going to be your drug of choice. Okay. And with the EpiPen, if you're wearing jeans or whatever you're wearing, you can just go ahead and give it right then and there. You don't have to, put it skin to skin, because you can give it through the clothes. Okay, and you can repeat it again if you don't notice change while you're waiting for 911 to come. All right, there's also other medications that we can give when someone's going through anaphylactic shock or severe allergic reaction. We can give Benadryl, prednisone, Zantac, any of those, but the number one drug of choice is going to be that EpiPen. All right, so for anaphylaxis, we can also see bee stings, insect venoms can be a cause of a reaction. So again, a lot of times the patients or the people who are going through anaphylaxis, they have a feeling of doom. They start to break out in a sweat. Their throat closes up. Their lips swell. They may have itching, and some people may even lose level of consciousness. So some people will pass out. Everyone reacts differently. Some people even have stomach pain, nausea, vomiting, shortness of breath. Everyone is different when they are going through anaphylaxis, but it is life-threatening. Okay, now let's talk about septic shock, also known as infectious shock. So this shock is caused by an infection. It could be bacterial, virus as well, but mainly a bacterial infection. Usually you have a high fever, and the patient will be restless, confused. Their labs will be out of whack, elevated white blood cells. The main causes of septic shock are usually UTI or even an abscess from your mouth. So rotten teeth can cause you to go into septic shock. So it's important for you to keep those dental appointments. Also, we will see this patient or people who are very at risk for going into septic shock are people who are very young and their immune system is weak, or people who are very old, or people who have underlying health issues, people who are lung transplant recipients or any other transplant recipient. And if you've recently had a surgical procedure, again, Foley catheters are a big cause of septic shock. So again, this one is a really big one, and it can cause death if it's not taken care of. So with any infection, we have to give them an antibiotic. If it is a bacterial infection, we may also give them steroids to help with inflammation and swelling. One thing to know about antibiotics: when you're giving people antibiotics, you must obtain a culture first. So we do a blood culture or a urine culture, whatever we suspect the infection is coming from. We obtain a culture and empirically start them on antibiotics. Once we get the culture sensitivity report, we can change the antibiotic. But we don't want that patient to die waiting on the culture results, so we will start them empirically on an antibiotic. Shock we will talk about is neurogenic shock, and by the name you can tell that it is something happening to your nervous system, your neural system. So this shock happens because we lose our sympathetic nervous system. So the nervous system has two systems, and those are parasympathetic and sympathetic. Parasympathetic is the one that relaxes everything and helps with digestion, while sympathetic nervous system helps with your fight or flight. So imagine if your sympathetic nervous system is not working, and fight or flight usually means your heart rate goes up and you're really alert, with the parasympathetic system only being the one working, your heart rate will go down because it helps you relax and rest. So what happens here is your veins, they all relax, they dilate, and so your extremities will have pooling of blood in the extremities, and the rest of your body will be cold. So we do get hypothermia when we see that. So what causes this? This is usually caused by a spinal cord injury at the level of T6 or above, but it can also be caused by spinal anesthesia, head injury, a reaction to insulin. So those are some of the causes of neurogenic shock. How do we treat neurogenic shock? Well, it depends on what the cause is. So first thing first, we're going to do an assessment on the patient. What you normally see, because everything is dilated, the veins are open wide, they're dilated, you're going to see sudden hypotension. Their blood pressure is going to go down. Also, like I said, their extremities will be warm and dry, and the rest of their body will be cold. So you will see hypothermia. And you will also see bradycardia, a slowing of the heart rate, because the only system that is working is the parasympathetic system. And like I said, fight or flight is not on board. So everything will be relaxed. Okay? So like I said, what are we going to do? Depends on what causes it. If it is a spinal cord injury, we need to make sure we keep that patient immobilized to prevent further damage. So how do we do that? If they were in a car accident, maybe we'll put them in a cervical collar. We can also put them on a backboard. If we're moving them, we have to move them all at once, which is called log rolling, because we don't want to cause any more damage to the spine. Also, we'll give this patient IV fluids to help with their blood pressure. Since they are vasodilated, their blood pressure again will go down, so we need to make their blood pressure go up. Also, we can give them medication to bring that blood pressure up. Those medications are called vasopressors, and they cause vasoconstriction. So we can give them epinephrine, dopamine, dobutamine. Okay, so those are the things that we will do for neurogenic shock. So I want you to think about the last three ones that we talked about, and those were anaphylactic shock, septic shock, and neurogenic shock. Those three shocks are also known as distributive shock. The reason why is because we see a lot of vasodilation with those shocks, and we know that the body and the vessels are dilated and the blood pressures go really low with that. With all of the shocks, their heart rate tends to go up except for neurogenic shock. So that's a key point to remember. All of the other shocks, your blood pressure will increase, but with neurogenic shock, your blood pressure will decrease. And with shock, we want to give them fluids. And remember, always when you're giving fluids as a bolus, you're rushing and giving fluids, you need to make sure you monitor their lungs, because we don't want that patient to get pulmonary congestion, pulmonary edema from all the fluids we give them. Okay, so thank you for taking the time to watch this video. Please subscribe on our YouTube channel, and we will see you next time. Take care. Bye-bye.